What if I told you that hypnosis and meditation work like different playlists for your brain, each setting a unique mood? Whilst both involve sitting quietly with your eyes closed, neuroimaging shows meditation strengthens your prefrontal cortex, whilst hypnosis alters activity in your default mode network. fMRI studies reveal meditation generates alpha waves tied to relaxation, whereas hypnosis produces both alpha and theta waves linked to creativity and visualization. This difference matters. If meditation hasn't worked for you, hypnosis might be the key, or vice versa. I'll break down what happens in your brain and share expert insights to help you decide which practice rewires your brain in a way you need. The brain under a microscope. When scientists compare brain scans of meditators and hypnotized subjects, the differences becomes clear. Functional MRI studies show that meditation activates the prefrontal cortex, the brain's control center for decision-making and emotional regulation. Over time, this activation strengthens neuroconnections, improving focus and self-control. Think of it like a daily workout for the brain. Each meditation session builds the prefrontal cortex resilience, helping it manage stress and distractions more effectively. Hypnosis, on the other hand, follows a different path. Instead of heightened prefrontal activity, scans reveal reduced functions in the dorsal anterior cingulate cortex, a region tied to critical thinking and error detection. This quieting effect explains why hypnotized individuals can accept suggestions without resistance. A 2022 study in Nature Neuroscience found that highly hypnotizable people have stronger connections between their attention networks and default mode network, enabling them to shift easily into absorbed imaginative states. EEG data further highlights these differences. Meditation primarily produces alpha waves between 8 and 12 hertz linked to relaxed alertness. Hypnosis adds theta waves 4 to 7 hertz associated with deep creativity and visualization. This theta activity helps explain why hypnosis can access memories and create vivid mental imagery more effectively than meditation. Research from the University of Zurich using fMRI shows hypnosis increases communication between posterior brain regions like the precuneus and occipital cortex, whilst frontal areas become less active. This shift away from executive control allows hypnotic suggestions to bypass critical thinking. In contrast, studies on Tibetan Buddhist meditation show alpha waves concentrate in frontal regions, emphasizing its focus on self-regulation. Dr. David Spiegel's team at Stanford's identified 3 key brain changes during hypnosis: reduced dorsal anterior cingulate cortex activity, increased connectivity between the dorsolateral prefrontal cortex and insula, and decreased links between the prefrontal cortex and default mode network. These changes create a state of heightened internal focus and reduced external awareness, the opposite of meditation's gradual strengthening of self-control. Meditation builds self-control over time, like training a muscle. Hypnosis, however, temporarily quietens critical thinking circuits, directly accessing subconscious patterns. This difference explains why hypnosis can quickly address habits like smoking, whilst meditation requires sustained practice for long-term change. What I do in my practice is targeting the habit at its subconscious roots, the speed of change. Why does hypnosis seem to transform habits in a single session, whilst meditation takes months of practice. Think about the frustration of trying to quit smoking or manage stress, only to feel like progress is crawling. Hypnosis offers a faster path, like flipping a switch, because it engages the brain differently. Meditation strengthens control over time by gradually building connections in the prefrontal cortex. Hypnosis, on the other hand, acts like a shortcut, directly rewiring subconscious networks through suggestion. Take pain management as an example. Research shows hypnotic suggestion can reduce pain perception by up to 50% in just one session. This happens because hypnosis modulates the salience network, which determines how the brain prioritizes sensory input. Meditation can achieve similar results, but only after weeks or months of consistent practice. Hypnosis works quickly by quieting critical thinking circuits and amplifying suggestibility through theta wave activity, whilst meditation builds resilience more slowly through deliberate effort. The same principle applies to breaking habits. A smoker using meditation must gradually strengthen willpower and awareness to resist cravings. Hypnosis, however, targets the habit directly, restructuring subconscious associations in just 1 or 2 sessions. Neuroscience explains this. Hypnosis reduces activity in the dorsal anterior cingulate cortex, lowering resistance to change, whilst increasing connectivity between attention and emotional networks. Meditation, by contrast, focuses on executive control, which helps manage cravings but doesn't rewrite the underlying patterns as efficiently. Brain scans reveal why hypnosis works faster for certain goals. During hypnosis, regions like the precuneus and posterior cingulate cortex, linked to self-referential thinking and memory, become highly active, allowing suggestions to integrate with personal identity. Meditation activates areas like the dorsolateral prefrontal cortex, which governs focus and impulse control, creating slower but steadier change. Clinical trials highlight these differences. Chronic pain patients often report relief after just one hypnosis session, whilst meditation takes weeks to show similar effects. Hypnosis delivers rapid results by temporarily altering brain networks, but its effects may fade without reinforcement. Meditation, although slower, builds lasting structural changes, making it a more durable solution over time. As it builds top-down control through gradual training, this explains why hypnosis works better for rapid habit change, whilst meditation creates a more steadier emotional resilience. The susceptibility factor. Not everyone responds equally to hypnosis, and brain scans reveal why. Approximately 15% of people are highly susceptible to hypnosis, whilst 10% show strong resistance, with most falling somewhere in between. This variation correlates with measurable differences in brain structure and function. Genetic studies link hypnotizability to dopamine system function and specific connectivity patterns between brain regions. Highly hypnotizable individuals show structural differences in attention-related areas, such as thicker cortices in regions controlling focus and awareness. Functional MRI scans reveal stronger connections between the central executive network and salience network, enabling them to shift attention more easily and become deeply absorbed in suggestions. A Stanford study led by Dr. David Spiegel found that during hypnosis, these individuals exhibit reduced activity in the dorsal anterior cingulate cortex and increased connectivity between the dorsolateral prefrontal cortex and insula. For example, one participant described how they could vividly imagine sensations like warmth or heaviness during hypnosis, a direct result of their brain's enhanced connectivity. Genetics also plays a role. Variations in dopamine receptors and neurotransmitter systems influence how easily someone responds to suggestions. These genetic factors shape brain connectivity patterns, determining hypnotic responsiveness. People with certain neural configurations experience hypnosis more deeply because their brains process suggestions differently from the outset. Brain scans can even predict hypnotic susceptibility. Individuals with greater baseline connectivity between attention networks and the default mode network tend to respond better to hypnosis, as their brains switch more flexibly between focused attention and imaginative states. Meditation, by contrast, doesn't rely on specialized wiring. Its benefits accumulate steadily with practice, making it accessible to nearly everyone. This linear progression means even people with low hypnotizability can benefit from meditation with consistent practice. The more someone meditates, the stronger the prefrontal cortex and connections become, regardless of their starting point. Gary Elkins, a professor at Baylor University and an expert in clinical hypnosis, explains if people are in the lower range, they may just need more sessions or more practice to achieve the same results. This highlights how hypnotic responsiveness exists on a spectrum. Whilst highly susceptible individuals see rapid changes, others can benefit from adjusted approaches, such as multiple sessions or even tailored techniques. The practical takeaway: brain scans can guide personalized approaches. Those with high hypnotizability markers may achieve faster results with hypnosis, whilst others might find meditation more effective for building focus and emotional regulation. Most people, however, can benefit from both practices to some degree. Matching methods to goal. Choosing between hypnosis and meditation depends entirely on what you want to achieve. Clinical research shows each method works best for specific conditions, and using the wrong approach can lead to unnecessary frustration. Whilst both practices help with anxiety, studies reveal hypnotherapy produces better outcomes for PTSD symptoms. Meditation, on the other hand, excels in improving focus and impulse control for attention disorders, such as ADHD, by strengthening the prefrontal cortex. For pain management, the differences are striking. Hypnosis can reduce pain perception by 40 to 50% in a single session by altering activity in the salience network. Chronic pain patients often report immediate relief through hypnotic suggestion, and conversely, meditation requires weeks of consistent practice to achieve similar type effects. The same contrast applies to habit change. Smokers using hypnosis can rewrite subconscious associations in just 1 or 2 sessions by accessing deeper theta wave states. Meditation, however, builds willpower gradually, fostering mindful awareness over time. Anxiety disorders respond well to both methods, to be honest, but through distinct mechanisms. Meditation strengthens emotional regulation in the prefrontal cortex, offering long-term stress management, whilst reducing generalized anxiety. By contrast, hypnosis decreases activity in the dorsal anterior cingulate cortex, lowers resistance to positive suggestions, making it particularly effective for reframing traumatic memories in PTSD patients. I've helped many clients reframe traumatic memories in my own hypnotherapy practice. Sleep issues also highlight these differences. Hypnosis directly influences subconscious patterns, leading to faster improvements in sleep quality. Studies show participants often experience better sleep even if they don't consciously notice the changes. Meditation, while slower to show results, creates more durable benefits through sustained practice. Weight loss provides another clear example. Hypnosis targets subconscious eating patterns and cravings, offering immediate habit change. Meditation supports mindful eating and long-term lifestyle adjustments, but doesn't access the deeper neural pathways controlling impulsive behavior. Think of these methods as tools in a mental wellness toolbox. Hypnosis acts like a precision instrument for rapid relief and habit change, whilst meditation functions as a steadier builder of emotional resilience and focus. Some conditions benefit from combining both. So, for instance, chronic pain patients might use hypnosis for immediate relief whilst developing coping skills through meditation. Anxiety sufferers might start with hypnotherapy to reduce acute symptoms, then transition to meditation for ongoing management. Together, they complement each other by addressing different neural systems, offering a balanced approach to mental, emotional, and physical well-being. Conclusion. The neuroscience confirms hypnosis and meditation serve distinct purposes through unique brain mechanisms, like two complementary lenses for adjusting your internal mental landscape. Hypnosis addresses specific issues with subconscious suggestions, whilst meditation builds general awareness through sustained practice. Brain scans reveal these methods activate separate neural networks, explaining their distinctive strengths. Try both approaches whilst noting your responses. Track changes in your symptoms, focus, or emotional states over time. Combining them can amplify effects. Meditation sharpens focus, enhancing hypnotic responsiveness. Mindfulness prepares the mind for hypnosis, whilst hypnotic suggestion reinforces meditative focus. As research has shown, these practices, they do complement each other when used strategically. Mindfulness prepares the mind for hypnosis, whilst hypnotic suggestion can reinforce meditative focus. The choice depends on your own objectives. Then after a few short weeks have passed, share your experiences or questions in the comments below. Your insights could inspire others to explore both of these practices. This is Marco Ocello. Thank you for watching.